Chapter 6, Examination and Treatment Quality, Eliciting Information. The second domain of PARS is examination and treatment quality, which takes into account eliciting information, active listening, informing and educating and counseling the patient, and conducting a careful, thorough physical examination. When you elicit information, it's not so much what you ask, which would be the content, but how you ask. So we're looking for articulate, understandable, straightforward questions. And it's different from the content in the sense that when you're asking specific history questions, the standardized patients will check off whether you asked the relevant questions or not, or whether or not the standardized patients gave the appropriate information based upon your interaction. So that's a simple yes-no checklist. So there's some scoring possibilities. One, it's possible that you could have scored poorly on a checklist, meaning that you asked the wrong questions, you were down a wrong track, but how you asked the questions was really quite good. You might have a good communication with the patient, but simply not exactly know what to ask. It's possible you could have a high checklist score, but very low PARS ratings under elicit information for the reasons that I'll explain as we move forward here. It's also possible, and this is the best situation, that you score very well in both the checklist and the PARS ratings. But it's also possible that you could score poorly in both of those areas, and if that it continues to be an issue, we'll give you feedback about that and bring you in for some remediation. So this is how you might think about working with the patient in order to score high, but more importantly, communicate well with the patient. When you start working with patients, for example, when they begin to talk about their chief complaint, what you want to do is to ask them some open-ended questions to get them to tell a story and to give you a better idea of what's on their mind and how they're seeing their illness, and then to follow it up with clarifying questions. So one example might be, let's say a patient comes in, asks to be seen because of chest pain, and you know why they're coming in. You just want to simply ask them, well, tell me more about this problem. Tell me about the chest pain. And you might be surprised by what the patient tells you. It reveals the patient's belief system, perhaps, that could be important in coming up with a robust treatment plan. But you want to also follow it up with clarifying or closed-ended questions. Well, tell me exactly, where does the chest pain hurt? And so again, you want to start with open-ended questions and then narrow it down with closed-ended questions every time you get into a new section of the medical history. It's important that you enunciate and pronounce your words correctly so that the patient understands, and that you have an organized system for gathering a history. So you're probably familiar by now with the mnemonic OPQRST. And here are examples of what the letters signify if you're not familiar with this. And I'm sure we've reviewed this with you in your history-taking exercise in the ICC. So OPQRST is used for an organized exploration of an acute problem. You're going to lose points if you appear to be disorganized, if you appear to be all over the place, jumping around from section to section, returning to other sections. So again, an organized history is important. Don't ask confusing questions, multi-part questions. Again, be straightforward. Don't machine gun questions, meaning you don't want to ask one question after another in rapid fire succession. Slow it down, ask a question, get the response from the patient. And don't ask multi-part questions, such as, tell me about your diet, your exercise, and your alcohol use. Those are three separate questions that would have to be explored separately. You don't want to mumble. If you're having a hard time with this issue articulating your words, or if you even have an accent, if English is not your first language, it's important that you maintain eye contact with the patient and give them as many cues as possible by, for example, letting them read your lips. So the idea here is to help compensate for, let's say, poor language articulation. You want to avoid leading questions, which is pretty common in medicine for some reason. You don't want to ask a question such as, no cancer in your family, no surgeries. Ask a straightforward question. Is there any cancer in your family? Have you had any surgeries?